Hello everyone. I am Nurse Masai Papantag, and my report is all about the role of the public health nurse. In promoting healthy nutrition, the public health nurse should first educate as many people as possible, particularly mothers, teachers, and food handlers on balanced and healthy diet. So, we all know that some of the mothers, teachers, and food handlers don't know how to handle or balance their food and having a healthy lifestyle and healthy diet. Second, assess for weight problems and unhealthy nutrition related practices. So for assessing weight problems is also the most important because weight problems is one of the most that problems that we've been facing right now because most of us is having a struggle on obesity and malnutrition. And of course, it is because also having a unhealthy nutrition. Third, screen for other risk factors related to nutrition such as blood cholesterol level and hypertension. So, screening or checking these kind of um, chronic diseases is important because by screening of these kind of diseases is will help you to be aware on how you to manage your food intake and on how you balance your healthy diet. Fourth, for person found to be at risk of NCD, advise and counsel for risk modification. Fifth, make referrals where appropriate. And six is advocate for a supportive environment where healthy food is available and affordable. So, of course, for advocating this supportive environment will help you a lot because you eat a healthy food. Nutrition assessment. Nutrition assessment or nutrition counseling start with proper assessment. They are direct and indirect measures of nutritional status. So, direct measurements for nutritional status include BMI, your waist circumference, and waist hip ratio. An indirect measurement of nutritional practices, it involves using the 24 hours food recall method. So these methods involve asking the client the type and a specific amount of food that you've been eating in the previous 24 hours. Nutrition education and counseling. So providing nutrition education to individuals and groups whenever possible is an important responsibility of the nurse. This includes clients who are well at risk or even with disease. Target groups for nutrition education includes your mother, food handlers, and food service people. So, when educating person in K position is to influence others like teachers, daycare workers, community, and civic leaders. Also, achieve a lot of in pushing for lifestyle change. So, it is also not enough to perform risk assessment and screening of individuals. Whenever screening is done, there is ethical responsibility to assess and provide support individuals who turn out to be at risk or positive for disease. One intervention is to provide nutrition counseling. So counseling is more individualized health education and addresses the specific problem of the client. Public health nurses are not expected to do extensive nutrition counseling. So if this is required, referral to the nutritionist is the appropriate action. However, the nurse should be able to provide specific information and assess the person to modify his or her risk. So, promoting supportive environment for healthy nutrition. Now, sometimes providing nutrition education or counseling to individuals is not enough to promote healthy nutrition. The environment plays a major role in influencing nutrition-related behavior, particularly in the availability and access to healthy food. Vegetable gardens.
So encourage vegetable garden.
Advise people to have vegetable plots in their backyard. Aside from being a healthy outdoor activity, it will provide the cheapest and most accessible source of fruit and vegetables. Campaign for nutrition-friendly environment. So, we encourage selling of farm products produced in the area, so making sure they are fresh and safe. Fresh foods are usually more nutritious and safe from all the chemicals and additives present in processed foods. Advocate for healthy policy for nutrition. Some of these policies include prohibiting drinking of alcoholic beverages, providing healthy food options, and limiting availability of soft drinks and junk foods in the school canteen, and prohibiting students from buying from street vendors during lunch break. Strict implementation of policies or school policies is also critical. Health workers plays key roles in advocating and influencing schools and local government officials. So by advocating this kind of policies is um, can avoid a unhealthy lifestyle or can balance their healthy diet and have a they can gain more a nutrition food than unhealthy food.